I am going to start first. I'm going to introduce our doctor, our physician this evening, Dr. Lynn Bornfriend. I'm going to pin you now. I'll add you to the spotlight. Hi there, Dr. Lynn.
Hi.
How are you?
I'm doing well.
Joining us. She has been treating patients over at Cancer Treatment Centers of America for the past 9 years, joining us on this panel tonight and really being able to answer any of your questions that you have where it comes to side effects and symptoms. So thank you, Dr. Bornfriend, for joining us. Next, we have Franmar Kopko, and Franmar, I'm going to add you as a spotlight as well. So Franmar, nice to have you, Franmar. Thank you for joining us. Franmar is over at Apothecarium as well. She is a pharmacist, graduated from Temple, I believe, and has been in this field for over 13 years. She is the Director of Education and Medical Professional at Apothecarium Dispensaries, and really gives us that behind the scenes look at what we should look for when we are going to a dispensary. And it's really important, right, that we understand what we're using and how to utilize that. And then lastly, and she's going to be our MC for tonight, is Michelle Moleski. And Michelle, I'm actually going to spotlight you there. Hi there, Michelle.
Hi. Hi, everyone.
Yeah, Michelle has been key in putting this program together this evening. Really happy to have you here, Michelle. And she is the Director of Physicians and Network Education engagement over at Apothecarium, and really has helped us. Like, we've had a relationship for probably 2 years now, I would say.
Yep, 3 years probably, 2.5 years.
Yeah, I know the COVID year, I don't even know how many years I can't score, right? But it's been really a wonderful experience for us, getting educated as a staff, as a board, like I said, there's just so much that's new and unknown to us, and we're trying to clear that up. So I am going to start with you, Michelle, and I'm going to remove these spotlights now, put you front and center.
Sounds like a plan.
Yeah.
We'll just wait till Sue pulls up the presentation.
You got it. Almost there, Michelle.
It's okay, take your time. I hate being the person in charge of Zoom, so I'm so glad that you are.
I am happy to do it for you. The more practice I get, the better we get at it, right?
Yep.
All right, so everybody, you should be able to see my screen here. There's our friend Michelle.
Yeah.
I am going to start you down
all the way to the top.
beginning. Yeah.
Okay, so welcome again, everybody. Thank you so much. As Sue mentioned, my name is Michelle. I'm the Director of Physician and Community Engagement at the Apothecarium. We're really excited to be here today to talk to you about medical marijuana and how it can help treat cancer symptoms. You can go to the next slide, Sue. So the Apothecarium, no, back up. Yeah, this one. So the Apothecarium is a full service, award-winning medical marijuana dispensary, and we're really focused on the patient experience.
That's a job.
Our dispensaries are known for really emphasizing education and customer service, not only to seniors, but also to first-time dispensary visitors and patients with severe medical conditions. Next slide. We were founded in 2011 in San Francisco. So we do have, besides having apothecariums here on the East Coast, we do have them in California and Nevada as well. But we really like to provide, we pride ourselves on providing patients with quality care in a really welcoming environment, focused on empathy, focused on education, and just really providing ongoing support. We really try to help the patient find the right medicine for your particular needs and help you understand how to use medical marijuana both safely and effectively. And you can see the quote here from the founder of Apothecarium, Ryan Hudson, that we aim to build a dispensary that you can be proud to bring your mother to. Next slide. So what makes the Apothecarium different than other medical marijuana dispensaries? Number one, we're vertically integrated, we're medically focused, and we're also physician and patient focused. So vertically integrated means that in addition to having a license in both Pennsylvania and New Jersey to dispense medical marijuana, we also have a permit to grow in both states. So in Pennsylvania, the growing arm of our business is called Alera Healthcare, and that's one of the brands that you'll find in the market in Pennsylvania. And then on the New Jersey side, our growing facility is called TerraSend New Jersey, because TerraSend is the parent company of Alera Healthcare and the Apothecarium. But we're all one big happy family, so I don't want to confuse you all with that. That's why you can just think of us as the Apothecarium, because that's where you would actually come to purchase your medicine. We're very medically focused. So when patients come to our dispensary, it's in many ways like coming to a doctor's office. The first time you come in, you'll have to, fill out some paperwork, talking about the different medications that you're on. You'll sit with a medical professional like Franmar, somebody on her team, to really, help you come up with a treatment plan and help you find the right products for your symptoms. And then we're really patient and physician focused in that we provide ourselves in educating both patients and physicians, just in like a forum like this one. Nobody can be a patient, in a medical marijuana patient in Pennsylvania or New Jersey without the approval and recommendation from a physician. So the physicians are so important, because without them, nobody else, you just can't even have access to the medicine. So we really see the value in our physician partnerships and being able to offer a continuum of care to our patients after they see the physician and get the recommendation. Next slide. So this kind of just highlights where our locations are and some of our brands that I had mentioned. So TerraSend New Jersey and Alera are our growers in New Jersey and Pennsylvania respectively. And we also have, you'll find Alera Healthcare products, Kind Tree Cannabis products, as well as Prism concentrates. And these are where our locations are. In Pennsylvania, we have Plymouth Meeting, which is in the Philadelphia area, and then Lancaster, which is in Lancaster County, Thorndale and Chester County. And in New Jersey, we have a location in Phillipsburg, which is right across the river from Easton. It's in the northern section of New Jersey. And then we're opening our next location in Maplewood in April. And as I mentioned, we also have dispensaries in California and Nevada, although they are recreational dispensaries, where our dispensaries here on the East Coast are strictly medical. Next slide. And I know some of you guys on here from Pennsylvania, maybe from New Jersey. So I wanted to kind of show the approved medical conditions for medical marijuana in both states. And you can see there are some overlap. In Pennsylvania, we have 23 approved conditions, and in New Jersey, there are 17. But as you can see, cancer is an approved condition in both states. And really in any medical marijuana program in the entire country, cancer is always an approved condition. And that's really because there are some studies that involved individuals who are in cancer treatment that have showed that medical marijuana has really helped in managing symptoms like chemo-induced nausea, pain, neuropathy, poor appetite, so on and so forth. And Dr. Lynn will get into all of that. Next slide. So this slide just simply shows, quick steps on how to obtain a medical marijuana card in Pennsylvania and New Jersey. Something else that makes the Apothecarium different is that we will literally like hold your hand, and walk you through the entire process. So, this will be, like Sue said, this is being recorded and you'll be able to get this information, but you can also email me, and next slide. And that was the slide we kind of started with that shows my contact information. Like, I'm the person to reach out to. That is my cell phone number. So you can text me, call me, you can email me with any questions, or if you need help with the process, or you need me to send you instructions, so on and so forth. So we're here to help you. That's kind of just like a really brief overview, because I want to introduce the doctor now and the pharmacist, so we can really get into the nitty-gritty about how medical marijuana can help patients who are dealing with cancer symptoms. So with that said, I'm going to turn it over, or have Sue turn it over to Dr. Bornfriend. I normally call her Dr. Lynn, so I'm not sure what how she wants us to call her, but she's awesome. And she's going to kind of tell you a little bit about her medical marijuana story, how she got into it, talk about, you know, and her clinical observations in treating cancer patients over the last 9 years. So thank you guys. And if you have any questions for me, you can hold them till the end. And we'll get Dr. Lynn up on the screen.
I thought I tried to do that.
No,
No, Sue will do it for you.
I
I am.
got you there. No
All
worries.
you got to do is talk.
Okay, I can do that. As a matter of fact, I told the other ladies that they may have to stuff a sock in my mouth or get a hook to get me off of the talking. And I just wanted to share with you guys that actually the last point in the bullet point, sometimes when I speak with patients and I raise the issue in an evaluation about, have you considered medical cannabis? One of the things people will say to me is, oh, honey, I'm not like you. I don't do that kind of stuff. And I always have to correct them. I have to tell them, listen, I was no fun in high school. I was no fun growing up. I have never taken a puff of a cigarette. I was not someone who explored all kinds of, I never smoked cannabis. I never did anything. I was a little good girl, and I really believed a lot of what I was told. And that continued. I drank alcohol now and then, but it wasn't a big part of my life. And that continued through my early years of my career, many years of my career. In 2014, my mother, who was 84 at the time, but was in perfect health. She didn't have a single diagnosis. She didn't take a single medicine. And all of a sudden she was diagnosed with stage 4 cancer. My older sister, who's the hippie, said something like, let's look into medical marijuana. And my response at that time was pretty self-righteous and obnoxious. So I insist on telling everyone about it to bring myself more humility. And that was absolutely not. I'm a licensed professional. My sister didn't club me over the head, and for that I'm grateful. My mother had been a high school teacher. So my mother's response was, I'm not doing that. That's what bad kids did, because that was her experience. My mother started her cancer treatment, and it was very exciting. Her tumors were responding. The problem we had, however, were side effects. And my mother came to CTCA, which is where I worked for 9+ years. And I was very pleased with everything there, but we tried everything we could think of, every intervention, every medicine. Her primary issues were nausea. And then my mother was very conscientious, so she would force herself to eat even if she didn't feel like it. So after she did that, she would get gas and cramping and pain, diarrhea, and then she had anxiety and insomnia. My mom was a pretty thin, petite woman to start with. So after about 8 or 9 months, they had to stop her treatment because she had lost so much weight that they couldn't continue. So cancer didn't get her, but she was essentially starving to death. At that point, my sister said, the heck with both of you, and came with a lozenge that had cannabis in it. When I heard this, I raced to the scene. I was, oh my God, this is terrible. And I showed up at my parents' house, and there was my mother, who was sitting up. She wasn't in pain. She wasn't nauseated. She wasn't anxious, and she wasn't high, and she was eating a little bit. Although it was too late for my mother after all that time, at 84, almost 85 years of age, after everything she'd been through, one thing I knew for certain, which was if my mother had had access to cannabis, her quality of life would have been vastly improved. Because every treatment, every intervention we tried, either it didn't work or she didn't tolerate it. And here was the first thing she was able to tolerate that was effective against her symptoms. Couldn't help wondering if she might not have lived longer, but there's not much to benefit in doing that, but it certainly impacted me and changed my entire outlook. So the first thing I did when I came back from after my mother passed away was start talking to patients at CTCA, and immediately began hearing, oh my God, thank God. I was afraid to say anything, but you know that medicine you give me for anxiety, or that medicine you give me for insomnia, I don't need that when I'm at home. And furthermore, that medicine they give me for pain, or that one for neuropathy, or that one for nausea, I don't need those when I'm at home. It's pretty interesting, pretty exciting. My mom passed away in May of 15. So in the past 5.5 years, I have been doing a tremendous amount of research. I've been exploring this. I probably certified and, or at least educated, because CTCA takes patients from all over. So it's not like they were all from Pennsylvania. Well over 1,000 people. And the impact of cannabis has been so exciting that I have turned into a bit of a zealot. I compare it for people when I say, did you ever meet someone who converted to a religion and became more intensely involved in the religion than people who were born to it? I think maybe that's why I'm so excited about all of this, because it's, oops, oh, there it is. Because it's not something that I came to naturally or in my youth, but I saw it much later as a professional. Dramatically changed the impact of my treatment of patients, and also the impact of the patients being treated through the entire Cancer Treatment Center's facility, because they spoke to each other, they shared information, and then they beat feet to my office door to get educated. When I initially look at a new patient's chart, I am scanning through to see a list of wide range of symptoms that medical cannabis can impact. So pain.
You can do the next slide, Sue.
Oh, yeah, pain, nerve pain. In that same arena, insomnia, inflammation, so that you see specific indications for fibromyalgia, for osteoarthritis, because inflammation is related to all of those things, cramping. And then in terms of GI, nausea, lack of appetite, and where it says GI issues, gas, bloating, cramping, things like that are often seen with irritable bowel disorder, like Crohn's disease or colitis. My mother's symptoms, my mom didn't have Crohn's disease or colitis, but that's what her symptoms were reminiscent of, the gas, the cramping. And then a whole wide range of emotional or psychological issues, from anxiety and depression and stress and post-traumatic stress and insomnia, and then things that are more thought of as movement disorders, so muscle spasms, seizures, Tourette's, Alzheimer's disease actually has a tremendous amount of research showing efficacy or improvement, multiple sclerosis, muscular dystrophy, HIV, cancer. And when I talk about cancer in that way, I'm not only talking about symptom management, I'm actually talking about cannabis having impact in actually fighting malignancy, which is a whole other area of excitement. I'm a dog lover. So one of my explanations is when I talk to people about dogs and I say, you know, a Chihuahua is a dog, but a Great Dane is a dog. And if you're looking for a Chihuahua and someone brings you a Great Dane, you're going to be unnerved and say, this is not what I wanted. There are so many different kinds of dogs. We call them breeds. In cannabis, we call them the different kinds strains, but there can be as much difference among the strains as there is among the dog breeds. So it's really important that you connect up with people who are knowledgeable so that you can share with them the issues you are dealing with and get very specific targeted advice, both to what strain, or think dog breed, that you might want to use, and what delivery method you might want to use. strains are divided up into 3 basic categories. And I have to tell you, they have ridiculous names. It's my contention that they were named by people who were intensely under the influence. So there are things like Maui Wowie and Bio Jesus and Granddaddy Purple. And you feel kind of silly as a physician saying, well, my recommendation to you is to take some train wreck with some White Widow, but that's where we are. But they are divided into 3 basic groups. And sativas, which are characterized as being elevating and uplifting, energizing, preferable for daytime, help with focused activity and productivity. And people describe a head kind of response or a brain response. And then there are indicas, which are nicknamed Indicouch. And those are relaxing, sedative, calming, preferable for nighttime, sleep aid, and useful for anxiety, but also very useful for muscle spasms. And then there are hybrids that are mixtures between the two. Oh, back to the indicas. Those are described as having a body or physical response so that you don't want to get up off the couch. And again, people who are knowledgeable about the plant, like the people at the Apothecarium, can help you choose what works for you appropriately. Then when a pill rolls off a conveyor belt, when a Tylenol pill rolls off, you know that the only thing in it is Tylenol. But cannabis is a living plant the way we are living creatures. We are made up of many, many chemicals, water, and I say stardust, divine energy, to turn chemicals in a pile of water into something as creative and difficult and challenging as we can be. So in the cannabis plant, there's several hundred chemicals, and many of them, well over 100 of them have some kind of therapeutic interactivity. The chemical we knew the most about and talked about the most initially was THC, and that's what makes you feel high. But there's a lot more to it. THC is an antidepressant. Depending on whether THC comes from an indica or sativa plant, THC can be sedating or stimulating. It is helpful for appetite and controlling nausea. THC is useful as an anti-anxiety agent, anti-inflammatory agent, useful for muscle spasms. And in addition, THC is helpful for getting some of the other chemicals like CBD to enter the cells ideally and be most effective. So in cancer care, I tend to recommend that you always have a product with some THC in it. And that means going through a dispensary, in my opinion, because in a dispensary, you know exactly what you're getting. Segueing into the next chemical that's kind of become the it girl these years, CBD. Everybody wants to talk about CBD. They have it in the gas station, they have it in your hair salon, and your neighbor who used to be selling Avon is now selling CBD products. But they are listed and controlled the same way supplements are. And unfortunately, sometimes when you buy something from the gas station or the hair salon, and it says it has CBD, but then when a third party comes in and tests it, there's nothing in it, or there's far less than you expected, or, and this is even more frightening to me, cannabis or marijuana is a plant. It grows in a field somewhere. So if someone says, oh, I want my plants to grow extra robustly, I'm going to spray them with pesticides. And then you go and buy a bottle of oil, cannabis oil that's made from that, you're getting concentrated poison, which is, of course, the exact opposite of what anyone wants, but especially a cancer patient. Same is true with if it's grown in contaminated soil with heavy metals, or if the crop becomes moldy and someone who's unscrupulous, doesn't get rid of it. Buying from a dispensary is so far the opposite of that, because when you hear about companies like Ilera, Apothecarium, all the other names, when a company is growing cannabis, the government is all over them. There's cameras, there's thermometers, they're checking the air, they're checking the temperature, they're checking the soil, they're checking the water. And if they go into a dispensary and there's 1,000 jars of something on a shelf, they might say, row 57, 12 from the back, give me that. And when they check that, it better be exactly what it's written on the package and nothing else, or the whole thing closes down. So whereas buying cannabis products or CBD products without that level of regulation, I think is risky, buying from a dispensary is exactly the opposite, because you know exactly what you are getting and you can repeat it. So if you go to the dispensary and this product works, you can go back and get that again, where if it's from your friend's plant that he got from his coworker, who the heck knows what you're getting, and that kind of thing. There are many
next slide, Sue. I was telling Sue to go to the next slide, Dr. Lynn.
Oh, okay. So when I talk to people about why cannabis, one of the issues I talk about is polypharmacy. So opiates are the easiest thing to talk about because they're so difficult and dangerous. When you take an opiate, it's usually useful for pain control. It has a lot of side effects. 90 to 95% of people taking opiates get constipated, and that's dose related. So if you need more opiate, you become more constipated. Opiates are associated with nausea, causing nausea. I threw up 5 times in the delivery room during my C-section because of opiate medication. Opiates are cause itching and skin, itching things that can happen. They're addictive. You become physically dependent on them, and they also kill people. And so well over 100 Americans die every day of opiate overdoses, and they are not all heroin addicts lying in the gutter. A lot of the times that happens with people who are prescribed opiate medication, and that is because the way opiates kill you is they send a message to your brain saying, it's okay, you don't need to breathe, and people stop breathing. Unfortunately, there are a lot of other medicines that we use in everyday life, but specifically in cancer care, that can also cause respiratory suppression. Gabapentin and Lyrica that are used for neuropathy, nerve pain, respiratory suppression. A lot of the old antidepressants are some of the new ones that are sedating, like Remeron, mirtazapine, respiratory suppression. The anti-anxiety medicines, respiratory suppression. The sleep medicines, respiratory suppression. Nausea medicines, Zofran, causes increased constipation. The rest of them, the compazine and Phenergan, which is prochlorperazine, and the other one I'm blanking. Anyway, they cause constipation, but in addition, they cause respiratory suppression. So you can imagine when you're using a bunch of these different medicines, the risks go higher and higher. And that's just of respiratory suppression. Polypharmacy talks about the fact that I give you opiate for pain, but then you're constipated. So then I have to give you a laxative, but then you get stomach spasms. So then I'm giving you Bentyl, but then I'm giving you something else for the this and something else for the that. And we may know what 2 medicines together do, but we have no idea what 10 medicines together are doing. And it's dangerous. So with cannabis, using that to cut, let's say I'm treating pain with that, but I'm also treating nerve pain with that. And then I don't need anything for constipation because it's not causing that. And it's not causing nausea. It's actually used to treat nausea. So I don't have to add that. And it's helpful for insomnia and anxiety and on and on and on. And at the end of it, it also helps fight cancer. That's pretty amazing. So that is one of the most exciting things. There is no lethal dose of cannabis. Important to know, because Tylenol can kill you. I am both an adult psychiatrist and a child and adolescent psychiatrist. And, adolescents sometimes would make suicide gestures. They were angry. They wanted someone to know how unhappy they were. Tylenol was really dangerous there because 15 tablets of extra strength Tylenol, 7.5 grams of Tylenol, can be enough to kill your liver, requiring you to either have a transplant or you die. That's amazing. You know, that's not a lot. There is no lethal dose of cannabis, none. So if you took a massive amount and it was way, way, way too much, you might get high as beep. You might eat everything that wasn't nailed down. You might sleep so heavily that I could draw a picture on your face and you wouldn't notice, but it cannot hurt you. So I tell the people when they're starting out trying cannabis, remember, you know, let's say you took too much and you're feeling weird and you're feeling frightened about, remember, I'm sitting on your shoulder and I'm telling you, remember, you can cuss me out next time we talk. You can tell me where to stick the medicine, but remember, it cannot hurt you. You will be fine. Go eat something, take a drink, take a nap. Actually, THC, which is the one that makes you feel high, if you take a squirt of a very high quality CBD, that actually helps to lessen the high psychoactive effects. So that's another intervention. Going back to CBD as the second popular chemical in the cannabis plant, CBD is not psychoactive. As I said, it can lessen the psychoactive properties. It's good for nausea. It's good for seizures. It's helpful for anxiety. It helps with insomnia. CBD also can lower your blood pressure, and it helps, it's neuroprotective. So when people are talking about peripheral neuropathy from chemotherapy, CBD and THC as well can be very helpful in treating nerve pain. So the next thing I like to talk about with people is different delivery methods. So everyone know about the plant and smoking the plant. Pollyanna over here didn't think anyone should ever smoke anything ever. So what I have come to understand is that smoking cannabis or marijuana is different from tobacco. It is not carcinogenic the way tobacco is. In addition, the way people smoke cannabis is very different from tobacco. Cannabis smokers often use it targeting a symptom. And what's really exciting is inhaled cannabis takes effect within 90 seconds to 2 minutes. So that people who are either smoking or vaping can take a puff, wait 90 seconds and determine whether they need another puff or not. That's amazing. If you had horrible nausea and I gave you a pill for it, you'd wait 45 minutes to an hour to find out if it was effective. And you wouldn't be able to modify the dose. You take the pill, you take the pill. Cannabis gives you much more freedom with that. So you can personalize the medicine in terms of how much you use. You can personalize the strain. You can personalize the symptoms you're going after and the delivery method. So inhaling is one way to use it. And there's a lot more information for people who have never inhaled a medicine. And, you know, certainly I was one of those people. But then there's edibles. And some people say, which are not yet legal in Pennsylvania, but people have the ability to make their own. And some people say, well, I just rather eat cannabis. The thing about that is that where vaporized cannabis takes effect 90 seconds to 2 minutes and lasts about 2 to 4 hours in your system, edibles can take 2.5 to 3 hours to even kick in. And it also is dependent on your ability to absorb food. So in cancer patients who might have had GI impact from their disease, that can be a challenge. So sometimes edibles are difficult because of that. In addition, the edibles are taken into your body. They go first pass by your liver. So that breaks down some of the chemical, but also waiting 2.5 to 3 hours can be, that's not medicine to me, unless you're on a regular schedule. Then there are oils or tinctures. Tinctures are more dilute, and you might be using a dropper full of the oil and you squirt it in your mouth. Now, if you swallow that dropper full, you have turned it into an edible and you can wait 2.5 to 3 hours. So when you squirt it in your mouth or put it in your mouth, you're supposed to put it under your tongue. When you place medicine under your tongue, about 40% of it is absorbed within the first 10, 15 minutes. And so it's shorter than the edibles. It's a little bit longer than inhaled, and its duration, edibles last a very long time. The oils and tinctures can be quicker than that. And one more thing is the topicals, which is the creams, the ointments, and putting that right on your skin. And I'd seen different questions about neuropathy. And what's so exciting about that is you could smear lotions with cannabis all over your entire body, and it doesn't go to your brain. You don't get high, but it can impact neuropathy very quickly. So I used to have some topical in my office. I'm not, that's definitely not legal, so don't tell anyone. But I used to have that in my office, and then someone came in talking about neuropathy, and I might say to them, go ahead and try this. And within a few minutes, say it's not going to make you high. Within a few minutes, I see people kind of poking at their fingers, and I say, you can put it on your feet. And people are ripping their socks off and smearing on the feet because it works so quickly. It doesn't impact your cognitive abilities. In about 4 to 6 hours, it may wear off, at which point you can reapply. They're usually in some moisturized base. So that's another exciting delivery method. One more thing, and then I'll shut up, which is, this is just the surface. There's so much more to talk about. And I strongly urge you to, if you try cannabis and it doesn't work the way you expect it, that's not the quitting point. That's the jump off point to return to the dispensary, return to the people who are giving your physician, and keep getting advice and working it through. There's so much variety. So I'm excited to have introduced it to you, but in the same point, kind of frustrated because there's so much more to talk about. And now I'll stop.
Thank you, Dr. Lynn. Thank you so much. And Franmar will now talk about choosing the right medical marijuana products in the dispensary.
Sue, can you go, I think like 2 more slides ahead to what are you looking to treat? Thank you. So after you get your card in the mail, when you, from registering, talking to a certifying physician and getting certified, you get your card in the mail, you make an appointment and come into the Apothecarium to talk with a pharmacist to figure out what this all is. It can be extremely overwhelming because, as Dr. Lynn said, there is a lot of information. And if you don't necessarily have that knowledge base or never utilized cannabis before, you're starting at ground zero, which is perfectly fine. We're here to, as Michelle said, she's at her end, is to hold your hand through the process of signing up and getting a card. Our job as pharmacists is to hold
that you, honey?
Is to hold
I'm
your
on
hand
a conference call.
To find out what's going to work for you, what you're comfortable with, what you're not comfortable with, and figure out what dose and what's going to work for your issues. So some of these here are some symptoms that Dr. Lynn had already discussed, and looks like part of the slide is cut off. That first column of check marks is supposed to say THC, the middle is CBD, and the last one is going to be a 1-to-1 product. So if you can kind of picture that, since it's not on the slide, when it comes to anxiety is usually best treated utilizing more of a CBD type of product. When it comes to stress, depending on how that stress is developing from, if it's a primary issue or a secondary issue, we might use a little bit more THC, maybe more CBD, or more of what's called a 1-to-1, usually around equal parts THC and CBD. Depression is usually treated with a product that's going to have some THC in. Pain, I get this question all the time. What do you recommend for pain? Well, my next question back is, what kind of pain do you have? Do you have nerve pain and neuropathy? Do you have pain from muscle strain or muscle spasms? Or do you have inflammation type of pain? Because all those different types of pain are going to be treated with different aspects from the plant. More neuropathy type of pain and muscular spasms type of pain is better treated with more of a THC product, when inflammation that causes pain is going to be treated with more of a CBD type product. But then maybe you have both types of pain. So then we're going to use a 1-to-1 and get the best of both worlds in there. When it comes to insomnia, THC is going to be very good, as Dr. Lynn mentioned earlier, with more of an indica type strain, because we want something to help you sleep. Nausea and lack of appetite are going to be treated best with THC. That's why cannabis is known for giving the munchies. We want you to be able to eat. A lot of treatments, your appetite is decreased, and we need to stimulate that appetite. So helping you get the munchies is beneficial for that. One of the questions I think is, what's a good dose for me? Well, it's a little bit of trial and error. One of my pharmacists kind of used the term in front of me. It's a dose discovery. We're trying to figure out what your dose is. We're going to start you off low. We're going to titrate you up until we hit. Our idea is not to, Dr. Lynn had mentioned, the THC aspect of cannabis can make you high or give you that euphoric effect. To us as pharmacists, that is a side effect. We do not want to get you high. We want to find that dose that is going to get you relief from your symptoms with no side effects. Side effect would be that high feeling. We're not here to get you high and loopy. We want you to be able to function and continue on your day with less or reduced symptoms. Sue, if you can go to the next slide. So we go over the different forms of consumption. How do you like to medicate? Dr. Lynn mentioned inhalation, flower, vape cartridges. Fastest onset, usually anywhere from about 1 to 5 minutes. Effects are going to last anywhere on average 2 to 2.5 hours. So it's a good fast acting type of medicine. Some people do not want to do anything inhaled. Perfectly fine. We have so many other options. You can do something orally. We have tinctures. They're going to come in a bottle with a dropper, measurements on the dropper so you see how much you're taking. Tinctures get absorbed sublingually under the tongue. You hold the medication under your tongue and it gets absorbed that way. Onset with tinctures is about 15 to 30 minutes, and then the effects are going to last 3 to 4 hours. You swallow that tincture, it becomes a solution, is what we term it. Going to take a little bit longer to kick in, usually about 30 minutes to an hour because it's in a liquid form, but it's going to last longer. Capsules and tablets, also, those are kind of our edibles in Pennsylvania. Dr. Lynn mentioned we don't have edibles like cookies and brownies and lollipops and things like that, but we have capsules and tablets. It's the same concept. It's absorbed through the gut. So it's going to take a little bit longer to kick in, but then the effects are going to last 6 to 8 hours. Dr. Lynn also mentioned topically. I will correct one point. She said that the topical products cannot get into the bloodstream, so you're not going to feel it. Most of the topical products available in Pennsylvania are just that. They have a localized effect. They're not going to get in the bloodstream. However, there is one company in Pennsylvania that makes a systemic absorbing transdermal topical. So you do have the chance of getting that euphoric feeling if you use too much of that systemic topical when you're using a topical. But most of them that are in the Pennsylvania dispensaries are not systemically absorbing. They're just a localized effect. So wherever you put that on, if you're rubbing it, if you have neuropathy in your feet and hands, works fabulous. Because it doesn't get into your bloodstream, a lot of these topicals, you can use it as much or as little as you want throughout the day into the night. It's not stimulating, it's not sedating, which is fabulous. Sue, next slide, please. When do you want to medicate? Morning, afternoon, evening, all day? That's something that you have to determine that we work with you for. You're in control of how we're going to do the treatment plan. We go with what you're comfortable starting out with. If you're a little hesitant and maybe one of your issues is insomnia, great. Let's just start out with something in the evening to figure out if that's going to work. Maybe if you're getting enough sleep, you're going to have less anxiety and less stress during the day. So we don't even have to treat for those issues during the day because getting enough sleep is going to help with some of these other issues. So you always start low and we adjust as needed. Sue, next slide, please. And then what's your comfort level? A lot of patients that come into us are cannabis naive. They've never done this before. Perfectly fine. We usually are going to start off with a product that is going to have low on the THC with that CBD. I like to refer, as Dr. Lynn said, CBD is kind of the antidote of THC. What happens is that THC binds to that receptor, and if it's a little bit too much, it's holding on. CBD actually will bump part of that THC off of that receptor. So you're not going to be getting all of that psychoactive effect. It's like the antidote to THC if you ever happen to use a little bit too much, which sometimes happens during your dose discovery process when you're trying to figure some things out. If you have some experience, we might start you off on low to moderate THC with or without CBD. And then if you're cannabis experienced, you know, you can go with that THC with or without CBD. One of the questions I think I saw was, you know, do we sell CBD products? We don't sell CBD only products in a Pennsylvania dispensary. You might have products in a Pennsylvania dispensary that are higher in the CBD, but every single product is going to have THC in it. You need THC with CBD and CBD with THC to help that plant work. We refer to it as the entourage effect. All aspects of the plant need to be there in order to elevate the effects and let that plant do what it does. I always say Mother Nature, it made a beautiful thing. And, you know, we've tried to emulate it with a particular prescription medication. Some of you might have been on, and it does not work. You can't reproduce the plant in a lab. You have to have all aspects of that plant working in harmony in order to get that experience and get that effect that we're looking for. And with that, I think we have time for a few questions.
We absolutely do. I'm going to stop sharing now. And then Franmar, you're going to be on our speaker view. I'll bring our panel back and I'll add them. And then let me find Dr. Lynn. But the chat has been busy. The chat has been busy. Yeah. So we can go through there. I'm just looking for Dr. Lynn now.
And while you're doing that, I would like to say, like, when you come to the Apothecarium, which kind of makes us, in my opinion, different than other dispensaries, is we will work with you as long as you want to work with us. So if you want to see a pharmacist every single time you come in, that is perfectly fine. If you want us to contact and follow up and you want to stay in touch and still have questions, we're there to answer questions. We don't charge you for the visits. We are free. We have patients that will be reaching out to pharmacists, 2 and 3, 4 times a week. Perfectly fine. We do that. Pharmacists have like basically a caseload where they're following patients, making sure if we need to tweak dosing, if we need to tweak, the frequency of when something is taken. The more feedback we get from patients, the more we're able to adjust things to get you a better result of what you're looking for.
And we do virtual. And we do virtual, just so you guys know, because with COVID and everything, I know, people with cancer have to be very careful. So this is something you can do over the phone as well.
Yeah.
So one of the questions, I think I'm going to start from bottom to top to see if I can go through them. Okay. How experienced are the pharmacists and the sales team?
So the pharmacists are very experienced. My pharmacist group is. I can't talk about all pharmacists from other dispensaries. So all of my staff I've personally hired and trained. I've been working in this industry in Pennsylvania for almost 3 years now. It's interesting because a lot of people, they're like, oh, Franmar, you're so smart, you know this. My pharmacists have gotten to the point where they've surpassed me with some of their knowledge because they are seeing, I'm not really seeing patients anymore, and they are. That's their whole full-time job, is to see patients, follow up with patients. They're constantly doing research, attending continuing education things. I always say I'll put my pharmacist up against any other pharmacist in the dispensary and across the state, and my pharmacist will blow them away. The knowledge base, the caring, the empathy, just wanting to help patients is absolutely above and beyond anything that's out there in the state.
Thank you, Franmar. And then there's, a lot of questions come through about the ability to work, especially in certain professions, nurse, doctor. Will that affect my ability to work? So I know that's a question a lot of us have.
That changes from company to company. CTCA actually released a written policy saying that if you worked there, as long as you had a state card, you were fine. Now, you can't come to work intoxicated with anything, but that's true of anything. But there are other companies which doesn't matter. Absolutely not. One of the things that I had mentioned when we were chatting as a group before this event was part of my zealotry, I guess. I've become also a little bit of more of a rebel. So one of the things I have come to with cancer patients is prescribing the Marinol, even though I think Franmar which is dronabinol, Franmar, when she was saying that the pharmaceutical artificial things are not comparable, they're absolutely not. As a matter of fact, briefly, when my mother, Marinol was one of the things that my mother failed, couldn't tolerate. It's because Mother Nature is a lot smarter than we are making our own pills. But in a toxicology screen, Marinol will pop for THC the same way cannabis does, and you don't tell the difference. And as a cancer patient, you are always entitled to be on dronabinol because it's not just for lack of appetite, it's also for nausea. And I don't care if you weighed 500 pounds, no one can tell you you don't have nausea as a cancer patient. So routinely then, I'm taking, don't ever say I said this, I'll deny it. No, but if you write a prescription for Marinol for someone and they go fill it, that kind of releases, as long as their company says, okay, as long as you have a prescription, you can have that. And it's so ridiculous because the same companies that would say no to THC and a tox screen, oh, but you can have opiates as long as you have a prescription, and you can have Valium, and you can have amphetamine, and you can drink tons of alcohol. No one's modulating or monitoring any of that. So it's that's part of why I don't feel like I'm doing the wrong thing by working this get around, because I feel like, in contrast, the opiate that might treat your pain is sure as hell not going to help you with constipation or nausea, and there's no way it's helping fight your cancer. So it seems to me that that's a better choice to start at least with cannabis.
Now, do you have to get a PA license to get your product in the state?
Yes. So when you're in Pennsylvania, you need to be a resident because you're going to need a state ID. I think I saw a question. You live in Jersey, but you're staying in Pennsylvania. You're a Jersey medical marijuana patient. Can you come to a Pennsylvania dispensary? The answer is no. There's no reciprocity across state. So New Jersey medical marijuana patients need to go to a New Jersey dispensary. Pennsylvania medical marijuana patients need to go to a Pennsylvania dispensary.
And to become a Pennsylvania patient, if you're going to move permanently from New Jersey to Pennsylvania or vice versa, you would have to then, get your state ID or your driver's license to then be able to apply for the program.
Mm-hmm. So Mary had asked, what is the safest way to use marijuana?
All of the forms available in the dispensary are safe, but I think what the question you're probably asking is, what's the best form for you? And that would take place during a consult when we discuss things and discuss issues and finding out what you're interested in treating, what your issues are, what your goals are, and then going over the different forms and what you're comfortable with, what you're not comfortable with.
And if somebody were to have like lung disease or something like that, then no doctor or pharmacist would ever recommend that anything be inhaled. So, yeah.
I'll be honest, as a pharmacist, we tend to shy away a little bit from the inhaled products. The main reason is because when you're taking an inhalation off of a vape cartridge or a flower or anything like that, you don't know how much THC you're consuming, because it's not, a vape cartridge is not like a metered dose albuterol inhaler that you get from your pharmacy, where each dose is so much medication. With the tinctures, the solutions, the capsules and tablets, I know how much cannabis, THC, CBD you're getting per dose, so I can calculate. We tend to like to use those more because I like to know how, not only what you're putting in your body, but how much you're putting in your body, because you need to know how much is going to work for certain situations.
Rebel here. One thing about that, and I agree, except that when people are struggling extra hard with, let's say, lack of appetite.
Oh, absolutely. Yeah, we'll recommend it. It's just, yeah.
And
I throw that out there. Yeah.
Yeah. And also that some people really get a notion of their own themselves. Part of what I like about cannabis as a medicine is there's so much involvement of you as the individual, so that being able to titrate it on your own is also exciting to me, as opposed to a tablet dose. But I agree with Franmar also. Another thing to say though about maybe not as much with inhaled, but cannabis, because of its anti-cancer effects, for example, putting cannabis on an area that has cancer is kind of it's not quantifiable at this point, but it's a positive. You know, I've heard about people with, let's say, cervical cancer or vaginal cancer using a cannabis in a suppository, getting the medicine right to it. So that's
And we
just,
do have
those in Pennsylvania.
suppositories available at least in Pennsylvania. I don't believe we have them in New Jersey yet.
and another thing about that, and Franmar, if I'm in error, please tell me, but what I've read and heard from patients is that using cannabis in rectally, remember when I said 40% is absorbed under the tongue? Well, the rectum has many more blood vessels. And so putting it in a suppository form, you should see what I'm doing with my little finger, 80% can be absorbed in the same time frame, and it goes through your body, treating pain, nausea, but it's a far decreased level of psychoactive effect.
Yeah, so vaginal or rectal administration with a suppository, it's not going to go through what they call that first pass effect, where it's going to get broken down by the liver. So you're going to get a full body effect with less chance of a euphoric effect.
Yeah.
Depending on how much you're putting in rectally or vaginally, you know, you might get a little bit of a euphoria, but we can easily control that with the amount of the suppository.
So Franmar, there's another question here. It said, you know, I'm estrogen positive. We had a couple that asked that and wanted to know if the THC would trigger estrogen at all.
Not that I'm aware of, but the thing with cannabis is, because it's still a Schedule I drug, there's not a lot of studies out there. And the studies that are out there, there's Israel has a couple of good ones, but the sample size of the studies are small. You know, when they're like 12 or 20 patients, that's not necessarily a good judge of how something is going to go. As of right now, no, I haven't seen anything. I've actually, you know, CBD has shown some initial hope when it comes to decreasing tumor size growth. So I've had several different types of cancer patients use higher CBD products from the dispensary, and we've seen through scans tumors start to shrink. So
it impacts apoptosis, which means actually killing cells, but also angiogenesis, which meaning a tumor might have blood vessels growing into it, and this can diminish that as well.
It is not a cure for cancer,
no,
you know, but it is a nice add-on
right,
with regular traditional pharmaceuticals that have proven to, you know, do the job. So if you can get a little oomph in there to, you know, take it over the finish line, why not?
My grandmother, I always say my grandmother, if she were here, would tell you she was Eastern European. She would say it couldn't hoit. That's how she said hurt. So it couldn't hoit.
We have, you know, somebody in the chat, actually, Betty was saying that she has metastatic breast cancer, HER2 positive, and secondary bone cancer. And she's been using Jaden juice tincture, 20-to-1 CBD, THCE for 4 years now. And she says that she'll vouch that it's successful and continuously relieves her bone pain and neuropathy. Is there something similar I can find in New Jersey?
No. Here's the thing about New Jersey's program, and since we just not too long ago had a dispensary, our first dispensary open there, I've discovered a lot about the New Jersey program, and they are, you know, for having their program longer than Pennsylvania. Pennsylvania is leaps and bounds above where Jersey is. Jersey is not producing a lot of product right now, and what product they are producing is going to be flour or Smoking is allowed in New Jersey, so they're going to have joints and things. They have some vape cartridges, but they do not have the selection that Pennsylvania does, because a lot of these grower processors do not have that up and running. So it's basic, you know, grow the plant, harvest it, dry it, package it, out the door. So Jersey is a little bit of a struggle when it comes to having a better variety of products. So at this time, something like that is not currently available in Jersey.
Yeah, but the good news is, because the Apothecarium is now in New Jersey, and we're, you know, part of Alera Healthcare, and Alera Healthcare has this beautiful line of medicinal products in Pennsylvania. We're actually bringing those products to New Jersey. They're just not there yet. So they will be. Like, the
Another thing is
tinctures-
that there's recipes online to make things. So I don't know about the specifics with Jaden juice, but you know, if you wanted to make an edible or you wanted to make a suppository, there are things online that are reliable. You have to stay away from the crazies, but that's always true online.
True.
There was a question
also-
from Christy Hoster. She had asked, does it affect the liver? I have had a liver issue, and I was wondering about the effects on that.
Does cannabis affect the liver?
Yeah.
I haven't seen too much, but that's another thing where we don't know how much it affects, and we'll tell patients, if you have some sort of liver problem or kidney problem, make sure you're going and getting blood work done and monitoring the situation. And if something starts to not be right or numbers tend to be off, then, you know, reduce, eliminate the cannabis and see if things go back to the way they were. A lot of this is just monitoring, because it is a Schedule I drug. So there's not a lot of studies out there with patients who have liver issues taking cannabis on a regular basis. So there's a little bit of a disconnect. The actual, you know, science and studies are behind because of how this plant is scheduled. It's almost like we know that it works, but we can't exactly tell you why, because we don't exactly yet.
I've read some really small studies about actually improving liver disease. So again, because because of the Schedule I and the fact that we haven't been allowed to have research, we can't really speak with authority, but it's interesting.
So I have a question here from Paula, and Paula, I know you had your hand raised, so forgive me if there's another one, just put it in the chat, but I saw one that said, can you show me an example where to administer the drop?
So the tinctures, I wish I had my, if I can run into right under the tongue.
Yep.
So you'll just take the dropper, drop the medication under the tongue, hold it there. We tell patients at least a minute, longer's better. It's honest there. Somebody, Christy, just had a bottle. Yes. Thank you for the demo. I would have stolen it from my pharmacist. I'm in the dispensary now.
And it looks like an Alera tincture too.
So yeah, you're just going to hold it under the tongue. So then that medicine can go through the blood vessels under the tongue and get absorbed sublingually. The longer you can hold the medicine there, the better. I'll be honest with you. You know, once you get after a couple minutes, who wants to sit there and hold a liquid under your tongue? Because that starts to get annoying. We'll tell patients, you know, if you're taking a large amount, break it into 2 smaller amounts, because you'll get better absorption, because more of that medicine can hit those blood vessels, as opposed to if you have a lot of volume in there, it's not going to hit that blood vessels. It's just hanging out in your mouth until you're like over letting it sit there, and then you just swallow it. And then it mostly is going to get absorbed through the gut.
Okay. And then does insurance cover?
Absolutely not.
So at this time, insurance does not cover. So it's a cash only type of thing. We don't do debit or credit cards in the dispensary because it's still a Schedule I drug. So I always, when people ask, I say, well, if they allowed us to take credit cards, they'd have to let the dealer on the street take the credit cards too, because it's a Schedule I drug. So that's why the dispensaries are cash.
Okay. And do the products expire at all?
In Pennsylvania, there is an expiration date on the packaging. It'll be a year from when the item was packaged. In Jersey, they have different rules. So they have a 90-day expiration date from when they were processed and packaged in order for the dispensaries to sell those products.
Right.
Okay.
But the products, you know, most likely after a year will still work, but the dispensary just can't sell them.
Yeah, okay. Okay, I think I got through most of them, and I know I want to be mindful of our time. It's 7:10. I thank you all for being on today with us. Know that we're going to put this on her library, as a recording, but you can continue to ask questions if you want to send them to me at sweldon@uniteforher.org. I will get them answered and pass them along. But Michelle, Franmar, Dr. Lynn, I thank you all for answering our questions and just giving us a little bit more education. I feel like, one of the things that I learned, and especially as a cancer survivor, and all the research that we do as patients in general, of our surgeon, of our chemotherapy, of our radiation, of our treatments, you want to do the same research when you are going into exploring medical marijuana. Don't take it lightly. Do your research, talk to different professionals in this space, so that you feel very confident of how you're going to be able to help utilize this type of treatment for you. All right, I think that's a wrap then. Thank you all for joining. Have a good evening, and again, thank you.
Good night, everyone.
Take care. Bye.
Bye.
Thank you.
You.